What is mental health and psychosocial support, or how we call it, MHPSS? Mental health and psychosocial support is a very important part of the humanitarian response that we have to provide when communities are affected by an emergency. The emergency can be an earthquake, can be a conflict. We might find communities needing to be refugees in another country, flying from a difficult situation. All of those circumstances are of course going to affect how we feel, our well-being, our mental health. This is why it's very important that humanitarian response has an integral part on the response to mental health and psychosocial well-being. How we do this could be through a very wide series of activities. For example, we might be needing to just support the community supporting itself, knowing that communities have their own ways to support each other, to care for each other, knowing that individuals have their own coping strategies and their own capacity to thrive. What we might be needing to do is to just create the space and the opportunity for those natural resources to come up and help the communities thrive. But we might also need to provide a little bit more of support, maybe some specialized services provided by psychologists or psychiatrists. But very importantly, we also know that we can teach and we can learn together as a community to provide all the levels of psychosocial support that would really help us all going through this difficult situation. This is why we use such a long-term mental health and psychosocial support, because we want to capture that what we want to provide is the whole spectrum between anything that is promoting mental health, preventing mental health conditions, all the way into providing more specialized support and responses to mental health conditions that might be coming up as a consequence of the emergency. Of course, we should never forget that there will be persons in that community who already had mental health conditions before the emergency. This is why this very encompassing term helps us to describe everything that is part of this global response to the mental health and well-being of the communities that are affected by emergencies.